So, Chasing the Dragon podcast, the Mike Dane episode. So, yeah, welcome. It's good to see you, man.
Great to see you. Thanks for having me.
Thank you. So, I mean, we've been talking for a few minutes, but it's been a while, so let's dive into some good stuff, like, let's cut right to it. Has the pandemic affected what you've been doing?
Oh yeah, absolutely.
Really?
Yeah, very much so.
Okay.
For me, in my professional world, you mean?
Yeah.
So, as a physical therapist, a year ago from now, we were barely hanging on to keep the offices open.
Really?
Yeah, I mean, overnight, 50% of our patients dropped off. There was a lot of fear in the beginning, and
Sure.
a lot of people, and a fair amount of the people I treat are elderly and maybe have some other medical conditions, so a lot of them chose to just hunker down and stay in place. And at the same time, all elective surgeries stopped from mid-March last year until June 1st.
I could see that. I didn't think of that, but I could see that. But on the flip side, it's like, if you don't feel well, like, I'm not talking like internally, like, illness. I'm talking like, I need to be able to move. I need to be able to feel able. You know what I mean?
Oh, absolutely. Sure.
Be ambulatory.
Yeah.
So I would think in most, but maybe not. I guess the fear of COVID was that strong.
For some people. And for some had no apprehensions at all and felt it was overblown from the get-go, and nothing was going to stop them from living their life the way they did.
Wow.
And others, and I guess some of that might also depend on how involved somebody's injury or limitations were, but I had some folks that were really limited, maybe in the early stages after a surgery, and they just said, not coming out.
Okay.
In a strange way, it actually reaffirmed my belief in what we do, because I saw some people that chose to hunker down, and then 6 months later, when numbers were going down and more understanding of the virus was out there and they felt comfortable to come back, in my mind I always wondered, like, would these people just get better just because time would heal them?
Right.
And they didn't. So
yeah, they didn't.
So it made me reaffirm my belief that what we do is important and has some value.
Cool.
For people that are coming to see us.
Did you have to... Okay. I saw how some doctors' offices would do, like, virtual appointments. Mm-hmm. Did you guys have to... Did you think about that, or did that make sense to...
We did.
Okay.
So we have one young therapist on staff who's a lot more tech-savvy than I'll ever be. So he became our telemedicine guy.
All right.
In our mind, not everybody was appropriate for it.
Sure.
Look, I heard of some other clinics that were pumping those televisits out as much as they could to earn revenue to stay afloat.
Okay.
I never felt right about doing something like that. But,
right on.
If exercise was a part of somebody's treatment plan, which it was for a lot of people, I thought there'd be value in, say, maybe doing one telehealth visit a week for somebody who wanted to. We can go over exercise progressions with them. We could show them. We could email them exercises if they were going to continue with it at home.
Okay.
And that really varied from some people that were older and doing very just basic functional movements to I had some young athletes that were in the middle of ACL surgery who just wanted to kind of hunker down and stay in their own place. So I was able to show them pretty high level dynamic stuff that they could do on their own. Okay. They could demonstrate it for me. And then I'd say, okay, that's your plan for the next week. Let's check in a week and I'll continue to progress you.
Right.
The thought never even crossed my mind of doing teletherapy until COVID came. And even if in some places we're dabbling with it a little bit anyway, if you have a snow day or something like that as a way to just kind of keep things regular with the business, I just said I'll never do that.
Yeah.
Until I was forced to re-examine it. But, we probably did it for 5% of our patients at the most.
Okay.
It wasn't something that we used a lot, but we did entertain it.
Wow. Do you think... Okay, so you said it reaffirmed your belief in what you do. Do you think that people... Not that they don't believe. And I was going to say that they don't have faith, and I don't mean that they don't believe it works, but they don't have faith in it. Do you think that happens sometimes?
Yeah. Oh, yeah, definitely. I have some people that come in and they'll tell me right away on day one, I'm here because my doctor said I got to do this. I don't like physical therapy. I don't believe in physical therapy. I don't think this is going to help. So, I know I'm fighting an uphill battle. And some people who put a lot of faith and trust in us and are really counting on us to hopefully help them achieve whatever their goals are. But I think as a provider, and I don't know if you experience this sometimes, even as an instructor with what you do. There's a certain amount of redundancy. I mean, all the people I deal with are different and unique, and that's one of the things I like about it. Just like a lot of your students are different and unique. Right. But every once in a while, you have a case that really tugs at you for a reason, and you've made a big difference in somebody's life.
Sure.
Maybe even help them with something that's different than what they came to you for.
Okay. Yeah.
But then there's other than those cases. There's cases where, sometimes it feels just a little routine, and I guess that's a good thing because we're doing a good job and doing it consistently.
Right.
But it then makes me question, like, how important is what we're doing, and so that was one of the few positives that I think came out of COVID for me on a professional level.
You've given me plenty of consultation over the years, and I believe. I'm a strong believer. And, if it weren't for you, Missy might still be, who knows, limping. This is one of those, it's a necessary thing. You only get one body, right? You get one body, and if you're living right, you're probably going to beat it up anyway. Yeah. And if you're living wrong, you're definitely going to beat it up.
In a different way. Right?
So it just seems to make sense. It's I guess you do weight training to preserve your body, but when you get hurt, physical therapy seems to be like that's what gets you back to zero. Absolutely. Back to neutral.
Sure. Yeah. And I think of physical therapy as sort of a spectrum. The majority of what I do is treat people with injuries. So if it was somebody who was a martial artist, a weightlifter, someone who functioned at a high level and lived an active lifestyle, then they're probably coming to see me because they have something that's preventing them from doing what they really love to do, or can't do it the way they want to do it, so they want to get back to that level. But so physical therapy kind of morphs into that anyway. Like when I see people ask me about yoga, I said the majority of what I do when I'm treating, say, the lumbar spine, the low back, and with the core strengthening and the flexibility, we might call it something different than what a yoga teacher would call it, but it's really kind of all the same.
Right.
So it's not just in my mind about preventing or healing from an injury. It's about effective and appropriate movement.
Okay.
Moving efficiently. So even for somebody that's not injured, just like you could go to yoga to get the benefits of yoga, physical therapy and yoga are sort of morphed in and of themselves.
Sure. Has the industry changed?
Yeah, definitely. It's in ways there's more access, and in ways there's less access, and I'd say this is kind of healthcare in general that I'm thinking of.
Okay.
When Obamacare was passed, more people had medical insurance, but through the years, co-pays have gone up, deductibles have gone up, so financially, there's nothing that says that you can't go to see a physical therapist, but it might cost you $50 a visit to go see a physical therapist.
Right.
So it's changed. And it's funny that you asked that, because I probably could have gone a lot of different directions with that. And immediately I go to insurance, because sometimes it feels like that's what's running our industry, unfortunately.
Yeah.
So it's challenging in that regard. The practice of physical therapy in and of itself always continues to change. There's different techniques that come out. But all with the end goal of trying to help somebody to move better, to feel better, to function at a higher level.
Okay. And I don't want you to name names unless there's someone that you want to be like, yo, this is the guy. Are there Is it the type of an industry where every once in a while along comes a guy who's doing something and you're like, whoa, look at what this guy's got going on. That's brilliant. That's clever. Does that happen?
Sure. Yeah, absolutely.
Really?
I mean, I think about if I rewind to when I was a student, I was influenced heavily by a guy named Brian Mulligan. He was a physical therapist in New Zealand.
Oh, wow.
And the reason I got exposed to him was one of my professors at Quinnipiac had studied directly under him and learned his technique. So, up until Brian Mulligan kind of had this idea and then experimented with it in his clinic over a number of years, if I was going to stretch your shoulder, you would be laying down, sitting up, your arm is limp, and I'm kind of moving your arm around, and maybe I'm getting in here and pushing and pulling different ways to loosen things up to make them move better. Brian Mulligan had the idea to incorporate what we call a passive glide, where the therapist makes a movement that you can't do with your own muscles as far as a repositioning, and then holding it while the person moves through a range of motion themselves.
Oh, okay.
So almost like teaching that body part, if it's the shoulder, if it's the knee, if it's the back, a better way to move.
Okay.
And if it's appropriate for that person, they'll have either better motion or less pain right away. So you know right away if it's effective. So, up until that point, there was a bunch of different joint mobilization gurus, and they all kind of did the same thing just a little bit differently from one another. But, Brian Mulligan came out with the idea of, well, why are we just doing this passively where the patient's not taking an active role and not actually moving using their own muscles?
Sure.
I can combine the two. I can do something that they can't do with their own muscles and show that body part a better and more efficient way to move. And there's always a lot of, I guess, fads, and I don't say that in a bad way in physical therapy. Like dry needling is getting a lot of news now, where to release soft tissue tightness, they're actually using needles and putting it in muscles in different areas.
Oh, wow.
That's gaining a lot of popularity, and there's been some pretty good results with it. I'm sure studies will come out in the years that follow that either support the use of it or refute. But there's a lot of trends that happen. Some come and stick, and some come and go.
Right. Is there anyone who doesn't get it? Like, in other words, anyone in your industry, like where it's like, whoa, that's taboo. You shouldn't do that.
Yeah.
Yeah. Don't name names.
I think like in any industry, right? There's certain people that are going to say, I've done what I've done for 35 years and it's worked for me, and I don't really want to hear that. And they've gotten good results, and I guess that's their right that they've earned.
Sure.
And some of the different techniques that come out, I think I don't know that I'm comfortable with that. Not that it doesn't have its place. I'm probably just not the guy that's going to learn that. I'm going to focus my...
Got you.
And I guess, right, like in the martial arts world, that probably happens, right? You've got a guy that says, my style's the only style, this is... And that's okay. That's their thing.
Yes. Yeah, it happens. And they might even be, like you said, good at what they do, good at their niche, but there's a whole world, or a whole bunch of other stuff that they could be incorporating and getting, better results, maximum results.
Sure. Yeah, it's funny. Because of, I think, the somewhat repetitive nature of what I do, nothing makes me realize how much more there is to learn than when I learn something else.
Right. Yeah.
So I go to a course or I read something and I think, wow, right when I thought like I was doing pretty good with what I was doing, and I've got all my tools in my toolbox that I like to use, and I'm doing pretty well, then this just opened my eyes to how much I don't know.
I love that. I love that. When it happens, you're like, wow. And then it might even inspire you to either adopt or take it on and modify it. You might find a new way to tweak it or whatever. So how closely do you work with a surgeon? Like, phone calls?
Oh, yeah.
Okay.
Phone calls, texts. And it depends on the surgeon. I mean, there's some surgeons that we do a lot of their PT. So, I have their cell phone numbers. They say, call, text whenever you need anything. And there's some that it's really hard to get them on the phone. Their patient may have come to me by happenstance, not because that surgeon necessarily said to come to me.
Right.
Before, and I don't have the in to get to break through the the wall that's set up in their waiting room.
Yeah.
So I may have to make 5 or 6 phone calls before I get a response.
Yeah, some of those guys are real rock stars.
Yeah.
Some of those guys, you get easier access to rock stars.
Yeah, I think you're right. Yeah, I can better sit down with Jagger.
Yeah, you know. Yeah, it's but they definitely work some magic, don't they?
Absolutely. I mean, yeah, it's amazing what we have at our fingertips for the ability to heal injuries and to.
What of all the things? So, all right, let's rewind for a moment. So, you played sports. Mm-hmm. I know you played baseball.
Yeah, soccer, hockey, and baseball growing up.
Right on.
And then mostly baseball. Stuck with baseball in college.
Did that was that part of the reason why you went into physical therapy?
Yeah, it's funny. I joke, kind of half joke, that it was the start of my senior year of high school.
Okay.
I hadn't really given any thought to what I was going to do for college. So my guidance counselor called me down for my beginning year meeting and said, so where are you with the search process? I said, well, I haven't started. So what do you want to do? I said, well, I want to pitch for the Yankees. Well, unfortunately, he's seen me play before, so he knew that wasn't an option. So he actually asked me a lot of thought-provoking questions about what do I like, and just my own interest. I used to read like muscle and fitness magazines. I would write up workouts for my friends that we played sports together.
Oh, cool!
Just because I enjoyed doing that. And I was always into kind of weight training at that point in my life, and I liked sports. I liked being around sports.
Yeah.
And then, so he's hearing what I'm saying, and somehow he got me to say I want to be in a profession where I'm helping people. That was something that was important to me. And I needed a profession where I'd be able to definitely get a job right away because I was going to be paying a chunk of my own education, and I couldn't just go study whatever I wanted to study and float around. I knew I was going to have bills to pay.
Study art.
Yeah. Right, exactly. Which there's nothing wrong with that. That's awesome, but I needed something that was going to help me to pay some bills right away. So he actually said, "What do you think about physical therapy?" So I don't know. At the time, it was a very up and coming profession. The job market was great. So I spent some time at local PT clinics observing, and I thought, this is something I could do. It kind of kept me tied in with the athletic community, doing something that I liked. I could definitely see how I'd be helping people.
Cool.
And I was able to get a job out of college.
That's awesome.
Yeah.
And you went to Quinnipiac. Did you, and then you, what was it, interned with at SCORE? Is that?
No, actually, I just found SCORE. They were looking to hire a therapist.
Okay.
So yeah, I went to Quinnipiac. I interned a couple internships near where I grew up in Troy, New York, up near Albany. I did one in Boca Raton, Florida, which that was pretty cool.
I bet. Yeah.
and one in Windsor, and then I decided I was going to stay in Connecticut. So I was just interviewing different places in Connecticut, and just sort of found SCORE by happenstance.
Wow.
The owner at the time, who's now my partner in one of the locations, he needed somebody like right away. He was taking a trip for a couple weeks, and he needed coverage, and he figured based on how busy he was, he needed part-time work. So I interviewed, and I said, look, I'll take anything part-time. I'm looking for full-time, but I'd be happy to start at part-time. And actually, I think I had said I was looking for full-time. So he called me back a couple days after the interview and said, yeah, I really only have part-time, and I probably need someone with experience. I really liked you. And I said, I'll work part-time if that's all you got.
Yeah.
So, that was on a Thursday, so Monday I started.
All right.
Yeah, and, he was, I think, hoping to find someone with experience because he was going to be away and he wanted someone to cover his patients. So, I got the extra fast tutorial to get up to speed quickly, and then
cool.
The rest is history, 22 years later.
Yeah, you must be doing something right.
I hope so. Yeah.
So, sports, I mean, I'm going to say, as if I know, but obviously you playing sports, especially at any, competitive level, must have factored into your education.
Oh, definitely.
Meaning an awareness or a knowledge of the different systems and the mechanisms of the body and stuff like that.
Mm-hmm. And I think maybe, even more so the psychology that goes along with it.
Okay.
You know, treating people coming back from injury, and every personality is different. So, you know, you and somebody else could have on paper the same injury, and I might have to handle the two of you very differently.
Wow.
Because
I never thought of that.
You know, you're a guy that is driven and is focused, and, you know, even from a standpoint of dealing with pain, you have felt plenty of pain in your life, and you handle it well. You've learned how to adapt and handle that.
Right.
Other people are very frightened when they have pain. So you're the guy that I probably have to tell, if I say 3 sets of 10, that doesn't mean 3 sets of 100.
Yeah.
So please just do. And then the other person when I say 3 sets of 10, that doesn't mean 1 set of 1.
Right.
You gotta actually push yourself.
Yeah.
So I think even just understanding the psychology of an athlete and how that sometimes comes into play with my practice. Not when I'm treating an athlete,
Sure.
or just when I recognize that someone might have those personality characteristics and tendencies.
Wow. I never would have saw that. Wow. That's awesome.
Yeah.
That's a big deal. You know, you hear sometimes discussed with sports, you know, an athlete will be like, I need a moment. And like, why? Well, I'm hurt. And then it's like, are you hurt or are you injured? You know what I mean? And,
Right.
and sometimes I find that people don't know the distinction, you know, and like, well, what's the difference? It's a big difference.
Huge difference. Yeah. If you're hurt, you can get back out there.
Yeah. Is there in your experience, is there a sport that you've seen that is like, not the most, but is there a sport that has the most injuries?
Yeah. Well, here's what I'll say. I don't know if I can name one sport.
Okay.
Yeah, I mean, obviously something like football comes to mind just because of the amount of contact in every single play. There's a lot in the news about, you know, awareness of concussions and, you know, what that means long term. But I think the trend of specialization in one sport so young for kids is causing a lot of injuries.
Oh.
So take a sport like baseball or softball, for example. It's very unilateral. You know, I'm a lefty. I throw the ball with my left hand. And only my left hand.
Right.
I swing from the left side of the plate. I run the bases one way.
Yeah.
Over time, that creates a lot of imbalances.
Sure.
So when we were kids, you know, maybe you played football in the fall, basketball in the winter,
Right.
baseball in the spring, and you were always out doing whatever in the neighborhood with your friends and
So you could
other
balance
kids.
it.
Yeah. So, but nowadays these kids is like, you know, your 7-year-old kid's got some ability. You know, now and it's probably a good thing in terms of the level of play that these kids are able to play at. But they're doing the same thing year round. There didn't used to be, and at least where I was from, indoor training facilities that you could,
Right.
you know, play all winter. But
Yeah.
these kids are still doing simulated games all through the winter. And
That's crazy.
yeah, and so because of that, you know, something like throwing a baseball, just to revert to that, it's very unnatural. I mean, our shoulders and elbows really aren't built to handle the rigors of throwing a baseball, especially for a pitcher that many times. But again, it used to be if you were doing that for 3 months out of the year competitively, and maybe 6 months between, you know, being at the park with your friends and doing that, but then you were doing other things in the other time of the year.
Sure.
You wouldn't tend to get the same type of overuse injuries
Okay.
that we're seeing a lot of now.
Right. A good friend of mine, we grew up together, and he was a good baseball player. And his senior year, he was, you know, vying for like the starting job. And as far as his speed, as far as his accuracy, he was probably the better guy. But that whole competing for the job, he just ruined his shoulder.
Pushed himself too hard.
Yeah. And, you know, I mean, he lives a healthy life, but put it this way, the guy who's never pitched,
Yeah.
his shoulder's better.
Yeah. Absolutely. Yeah.
More durable and more functional.
Yeah.
Yeah.
No, I mean, that's the demands. And so I guess, is there one sport, I don't know that I could off the top of my head name one. Are there certain injuries I associate with different sports? Definitely.
Okay.
Yeah,
Okay.
definitely. I mean, you'll see ACL injuries in basketball and football because of contact and the real sudden changing of directions. You'll see overused shoulder and elbow injuries in baseball a lot.
Right on.
A lot of hand injuries in martial arts.
Right.
I mean, those are things that I've seen a lot of in my career.
If someone wanted to, as far as put together their own personal maintenance, what would you suggest someone do?
So that's a great question, and I think if you had to pick just sort of a generic, it would be whole body stretching, and core strengthening. If I had to, so when you think about yoga, which I know you're a fan of yoga, that's or Pilates, which yoga and Pilates are different, but a lot of the underlying principles of what they achieve are similar.
Sure.
As far as maintaining good muscle balance throughout one's body, and that's flexibility and strength, and the idea of the sort of the prolonged, longer duration contractions. So, not that I'm going to take a weight and lift a heavy weight 3 times, as fast as I can, but maybe I'm going to be doing different things out of a plank position for 30 or 60 seconds or more. I think that's probably a more functional strength, and it's one that you're less likely to get hurt doing in the moment, and more likely to build that injury prevention. Cool.
How about power lifters, right? Those guys are beasts.
Yeah.
And not to slight them, but you've got to be a little off center to let's drag a tractor. You know what I mean? But it's awesome what they're able to do.
Yeah.
What kind of injuries do they see?
Yeah, I mean that sometimes you'll see some really gruesome muscle ruptures, like a pec rupture. Actually, somebody was just showing me a video. I don't know where he found it on YouTube of a guy, incline bench pressing some obscene amount of weight, and you just saw his pec let loose. It was one of those things. You want to watch it again, but you got to turn away.
Right.
It probably took like 4 times before I could actually just watch it without turning away.
Wow.
So sometimes they'll have tendon ruptures. They're putting such load on. So muscle becomes tendon and then joins a bone. So especially as we all age, our tendons tend to lose a little elasticity.
Right.
But for powerlifters, they can maintain strength a lot later in life than boxers or fighters' reflexes may start to diminish in their 20s and into their 30s. So they make some adaptations to be able to stay at a high level. But from a standpoint just purely of strength, a lot of powerlifters probably peak in their late 30s, and they can stay really, really strong and through their 40s if they keep training that way.
Wow.
But the problem is Father Time always wins, and those tendons aren't 20-year-old tendons anymore.
Yeah.
So you're putting a tremendous amount of force through the muscle, and it's tugging on that tendon that's not as healthy as it was 20 years ago.
Sure. I can remember seeing some of the guys in the gym, and I don't mean my gym, I'm talking a regular workout gym.
Yeah.
And I've seen guys who you could tell that they were lifelong gym rats. I don't know if they actually followed a program or they just sort of kind of went intuitively. But then I've seen guys who it didn't look like they knew what they were doing. They're just, and they move a certain way. So maybe they've retained their strength, but sometimes they might lose that quality of movement. Does that happen?
Oh, yeah, I think so. Yeah, I mean, so when you talk about imbalances too, so powerlifters, and I'm like you said, I'm impressed by what they can do. I could never do it.
Right.
But yeah, certain muscles tend to get overdeveloped, and so they've got big pec muscles, big lat muscles, but that kind of turns their shoulders in this way. So you think about that classical, kind of bodybuilder posture walking around. So ask that person to just do this. They probably can't do that.
Sure.
That motion that went away 20 years ago for them. and so when you think about training for sport, powerlifters train to be powerlifters. But that doesn't necessarily translate to be a good baseball pitcher or a good martial artist. Or how many times have you seen a fighter who gets overly developed from a muscular standpoint and they fatigue?
Yes.
Or they can't move as well. And they might not even be as functionally strong as somebody that doesn't look as bulky as them.
Right.
So you see that guy with his shirt off, it's like, wow, that's a big dude right there. Well, he might not be as strong as the guy that's 30 pounds lighter than him, who moves well and has functional strength throughout motion.
Yeah. Is there a difference between how men and women's bodies recover during the process?
That's a good question. I wouldn't say there's a difference between men and women as far as recovery. There's anatomical differences that you need to consider when you're rehabbing an injury. Female athletes are far more prone to, say, ACL injuries because of the angle of their hips and their knees and how that puts stress on the ACL.
Right.
I think most people heal on a similar time frame, but testosterone does play a role. So, and growth hormone plays a role in terms of recovery. So a younger, 20-year-old male is going to heal differently than a 50-year-old female.
Right.
But also differently than a 50-year-old male.
Right.
As those hormone levels change throughout life and then within the genders. But I wouldn't give a generic answer to, yes, females or males generally recover differently.
Okay.
With all else being equal.
Okay. So since we mentioned women, right? You see, or I've read, and I don't know, that what is it? Osteoporosis.
Yeah.
Does that at some point, is that like a thing that you might have to consider with planning out someone's recovery?
Oh, absolutely.
Okay.
Yeah, sure. If a woman has osteopenia or osteoporosis, when I say woman, it could be a man, but it's far more likely to be a woman. They're afflicted with it more. There's certain things that we just can't do. I mean, I can't do like high thrust adjustments on a woman with osteoporosis because she could fracture if she has osteoporotic bone in that area. But from a prevention standpoint, there's a lot of things that can be done as far as just weight-bearing exercise, strength training.
Sure.
Is great for prevention or for slowing the progression of osteopenia or osteopenia is kind of like what you start with, and then it becomes osteoporosis is what it advances to.
Here's one. So I've been to your facility. Is there? You've got a lot of stuff in there.
We got a lot of cool toys.
Yeah. I'm like, what is this thing? I could play with this thing. Is there anything that you've always wanted? Like, if you could design like the ideal facility, is there something that you would have, or do you think that all facilities need? Or
well, one thing that I don't have that I'd love to have, but I think it goes for about $25,000 is the weightless treadmills. So
okay.
I don't know if you've seen those, but I'm only aware of one place in Connecticut that has. It's up in Hartford. It's hospital owned, so I think they probably have deeper pockets than the average PT running his own practice.
Yeah.
But it's almost like you stand in this bubble, and it takes your body weight up. So, think about early return to running for an athlete, who maybe isn't allowed to weight bear fully.
Yeah.
Maybe they had an ankle fracture, and it's just starting to heal. So they're not even walking yet without crutches, but you could actually get them on there and walk and even jog to set it so that there's minimal weight actually going through it.
That's crazy. Wow. Okay.
That's a fun toy I've never been able to play with. But, in my dream world, maybe there'd be a time and place where I'd have access to something like that.
Sure.
It's not appropriate for every person that I would treat, but it would be, a game changer for a lot of people at an early stage in their rehab.
Wow.
I think, and that question is great because 20 years ago I would have answered it differently, but I think in some ways less can be more. I mean, I think body movements just with elastic resistance, functional movements.
Sure.
We, in the Middlebury office, we have a full gym.
Right.
And I do use that equipment because I think it has its place. But do I think all that's 100% necessary? No. I think you can really get great results. It's nice to have.
Right.
But I think as I've learned a little more about whether it's yoga, Pilates, or just functional movement exercise, there's a lot to be said for just expanding your knowledge with that and incorporating that into the treatment plans.
Cool. Maybe one day there'll be a movie about a guy who rehabs from his living room using like cans of soup and water jugs.
Yeah.
You know what I mean?
We end up incorporating a lot of that. I mean, I encourage people to do as much as they can at home, and I give them those exact tips. You know, if you don't have 1 pound weight at home, a can of soup probably weighs about a pound.
Right.
Take that. You need an 8 pound weight, and take that empty gallon of milk and fill it with water. There's your 8 pound weight.
Right. What about so your kids play sports?
Yes.
Have they ever sustained any injuries?
Nothing terribly significant, other than the kind of average sprains and strains. Fortunately, they know my office well for all those sprains and strains. They have spent a fair amount of time there. My daughter did have a cyst within her lower tibia, so just above her ankle.
Okay.
That's just congenital. We just discovered it incidentally on an X-ray because she had gotten kicked there and an area stayed swollen. So we said, I better get an X-ray and make sure it's not a small fracture. And she ended up, after watching it for a few years, having to get that surgically removed and then a bone graft put in.
Wow.
Just because she was playing soccer at a pretty high competitive level, and she was getting older to where the game was getting more physical.
Mm-hmm.
The cyst was pretty big, so she becomes a bit of a fracture risk with the cyst in there.
Oh wow!
And the main thing was it started hurting, and we couldn't get it to settle down. Usually, that type of a cyst doesn't hurt.
I see.
But in her case, she was having some pain, and it was affecting her performance and her ability to be pain free.
Wow.
So she went down to Yale. They did a great job. Took the cyst out, put some bone cement in, a little piece of cadaver bone, and she's good as new.
Wow. What is there a key ingredient that helps with recovery? So, like, in other words, I guess genetics must factor in somewhere, but beyond genetics, you know what you're doing, you've got knowledge, but is there anything else that factors in to recovery?
I think if I had to pick one thing, I would say the psychology and the mindset of the injured person.
Oh, well, okay.
Just simple example. Again, I'll take you and I. Let's say we have the same shoulder injury, and I might be the guy that focuses on what I can't do with this shoulder. Mm-hmm. Let's say we're both 95% healed. You can do the MRI; they look the same. I might say, well, it hurts here when I do this. It hurts here. And you might say, well, I'm just going to do everything I can except for that movement that hurts and get it better.
Right.
So, it's the same injury, but how somebody chooses to handle that injury as far as working around it to eventually be able to work through it, versus, the time where somebody gets hyper-focused on what they can't do and gets hung up on that.
Wow. That's really good to know, because who was it? It was... Do you remember Roger Craig?
Yeah, sure.
Football player?
Yeah.
So I remember I read something. I had sustained an injury. And during the time I was recovering, we're talking like a long time ago. A long time ago. I had sustained an injury before I met you even.
Okay.
And I remember I just happened upon this article about Roger Craig. And they had basically said that he almost willed himself to heal. Mm-hmm. I'm like, I don't know about that, but I gave it a shot. I didn't sit there and will myself to heal, but I definitely believed in it. Mm-hmm. But so, the psychology of it, that's wild.
I don't remember his name, and maybe you do, but there was a guy on the Jets who was paralyzed in a game. And, for weeks, I kept hearing on ESPN how, unfortunately, he was probably never going to walk again. They said no to professional football, which he never did get back to. He broke his neck on the field. Oh. And I think it was like a year later, at a home game, he walked onto the field.
Wow.
Like to before the kickoff.
That's awesome.
Yeah. I mean, so there's a guy who, some things happen physiologically and biologically that allow that to happen. Right. But plenty of people, when you're hearing over and over and over again from the doctors, you're never going to walk again. Yeah. Some people are just going to say, okay, I'm not going to walk again. Wow. He wasn't cool with that. Yeah. He was determined to walk again.
Good for him.
Yeah.
Wow. How about the level of play? So, like, in other words, do you find that a high school athlete might be more receptive than a collegiate or professional, or is it like the professional's like, no, we're gonna get back to, or that's not really?
You know, I don't know that I could generalize about everybody, but I will say the younger athletes you have to be more careful with, because just where they're at. You know, the 16-year-old athlete, 16-year-old anybody thinks that nothing's going to happen to them, right? We were there before.
Oh yeah.
You know, like
indestructible.
Right? So even though a professional athlete has achieved a higher level in their craft, than the 16-year-old, a professional athlete may have acquired some wisdom depending on how old they are and their life experiences. And I've had the good fortune of working with some professional athletes, and in my limited experience in that world, I found them to be great patients. One guy in particular was a Major League Baseball pitcher who he put a lot of faith in the doctors and trainers that he was working with. He's from Connecticut, so he ended up coming back to Connecticut for a 6-week period and found me and continued his rehab with me.
Oh wow!
So this was a guy where, whatever I said, he bought into it, and he was on board with it.
Wow.
Whether that meant you can do more or you need to pull back and do less, he didn't really question it much. He had been through another injury that almost ended his baseball career, and came through it successfully. So I think he had a lot of faith in in his medical team that helped him to get there.
Do you find that your diverse background in sports, because I mean, hockey, baseball, soccer, and then you've done jiu-jitsu. Mm-hmm. So do you think that, for lack of a better way of saying, it gives you an edge over, say, because I would imagine there's got to be some physical therapists who never played any sports.
Yeah, sure. Yeah, I think so. And I think I'll take it even a step further. I've had some injuries and some surgeries, and I'm very open about sharing that with people. So when somebody comes in with a disc herniation in their back, right away I'll talk about my experiences with my own back. Sure. And they'll say, "Oh, so I'm not going crazy." I really do feel that. So I think anytime you can relate to somebody, and yes, on a couple fronts, I think it's helpful. One is understanding down to a very minute detail the mechanics of what it is that they want to get back to. Understanding that for a jiu-jitsu player, certain sweeps might put a lot of torque on your knee. So if someone's coming to me after an ACL surgery, I can articulate that to them. Like, hey, even when you start to get back to certain, to limited activity within the sport, having those experiences, I can tell that person, hey, you can do this, this, and this. You need to find an experienced training partner who is going to be able to go at that speed, but you need to avoid this, this, and this, because that's what's going to probably put more stress on your knee than your knee is ready for right now. Cool. Don't go with the rookie who's going max effort all the time. That person's probably more likely to hurt you. But go with somebody who's got some experience, and you can tell them, hey, don't do this, and I'm not going to do this or that because that's what my therapist says not to do. So, yeah, I think understanding exactly what goes on in those sports physically gives an advantage.
When you, I guess, so do you form, not necessarily, I guess maybe an alliance or develop a referral system with a surgeon? Is it one of those things where you're like, I want to work with this guy, or is it, you know what I mean? Like, or is it like something where it's like, this guy deals in an area, he's cutting up everybody. Mm-hmm. I don't know if how is that? How does that play out?
So yeah, no, it's a good question. I've had the really good fortune throughout my career of a lot of the surgeons that we work with and see a lot of their patients are really good surgeons. Cool. I mean, the greater Waterbury area for orthopedics has a lot of top-notch surgeons.
Really?
Yeah.
Wow.
And I don't know enough about the other areas of medicine to be able to say the same or different about, but I just know because what I deal with is orthopedics. Really, really good surgeons there.
Cool.
I mean, there's surgeons that have been team surgeons for professional sports teams previously when they were younger. That were tied in with industry leaders in their field through their training. So, and on top of that, the surgeons that I've worked with, I feel like are all very ethical too. Like they're not going to tell you need surgery because their kid needs braces. And I hope that doesn't happen a lot elsewhere.
Right.
But I just know the people that we used to do a lot with, I don't see that.
Cool.
So, good caliber of, high ethical standards, but good surgical care too, good surgical ability, which always makes my job a whole lot easier.
Wow. Right on. Speaking of job, easier. What's the hardest part about your job?
Yeah, I'm going to go right back to the whole insurance thing. We're often forced to do more with less time. People sometimes have restrictions on how many visits they have, for example.
I see.
So where it used to be before I got in the field, 30 years ago, just treat this person until they're better. Now it's like, well, yeah, make this person as better as you can, and you got 20 visits to do it, and they had a surgery, they probably need 40 visits.
Right.
So kind of doing less with more.
Okay.
And then there's the whole balance about insurance reimbursements, and you need to see a certain number of patients in a given day to pay your bills and keep the lights on.
Right.
So you have to balance. You have to be very efficient with your time. Where I oftentimes wish I had more time to spend with somebody, even just because I'm interested in people and enjoy what we're doing right now, sitting and talking.
Sure.
But if I did this all day and only saw a few people, my doors would be locked real soon.
Dark in the building.
Yeah. So I think I think finding that balance too between being as efficient with the time that you have with people to get as much out of that visit as you can, but also knowing that you have to see a certain number of people every day to keep the lights on.
Sure. As far as, is there ever a need for follow-up? Does that ever happen?
Yeah, absolutely. And I have some people, if they have like a degenerative condition like arthritis, I try to give people the tools that they can manage their condition on their own, whether it's an exercise program, stretching program to keep up with. But I'll tell them, you'll be in for a tune-up. You let me know when.
Right on.
Yeah, and even sometimes as I finish up somebody's plan of care with them, I might be seeing somebody 2 and 3 times a week, and then it might go down to once a week for a couple of weeks, and then I might say, just stop in or give me a call in a month.
Right on.
Or obviously if you have a problem beforehand. So, and I have a couple people that will just routinely come in for one visit, sort of out of the blue, because they've got some questions about their program and what they're doing. So it's different with everybody, but sometimes there is that sort of long-term follow-up.
Cool. How about athletes? So, do you? Nah, you're a social person. You're sociable. So, like, I was gonna say, do you find that it's more fun to work with athletes, or is it more fun to work with professionals of a different type, or is it just, just come in, let's see what we got going on here?
You know what? I really like the diversity that we have in our practice. Some practices have a very narrow focus.
Okay.
They do sports rehab. They deal almost exclusively with athletes. Some have a geriatric focus. Like they're going to hit up the local senior centers, and that's what they want, because that's what they do best based on the knowledge and expertise of the therapist. My focus is pretty much orthopedic, musculoskeletal.
I see.
But within that, I've had patients as young as 4, and I've had patients as old as 96.
Wow.
So obviously the goals for the 96-year-old and the 16-year-old athlete are different.
Come on!
Yeah. One of the things I like most about my job is the amount of different people I've met.
Sure.
I mean, I've met some really, really cool people, and I'm sure you have too with, in your world.
Yeah.
And so I like the variety. If I had to just think about the kind of the mechanics of what I'm doing, I'd probably say athletes. But honestly, I wouldn't want to narrow my focus that much to where I'm just working with, say the 10 to 35-year-old demographic. I really enjoy the diversity and the variety that we get.
Cool. Is there an aspect of what you do that you've been wanting to branch out into or something? Or like, is there uncharted territory? You know what I mean?
Yeah, I mean, I always have thoughts.
Okay.
And I mean, even just from a pure business standpoint, there was a time 5 to 10 years ago that I thought I just wanted to grow. I wanted I bought the practice that I'd worked at for 10 years,
Yeah.
and then I bought 2 other practices and kind of brought it under the same umbrella, and then I opened up another one and on the other side of the state, which is no longer open under our ownership. And then I got to a point where I was like, man, if I do any more of this, it's going to be hard for me to continue to treat full time.
Wow.
And that's what I enjoy doing. And quite frankly, that's the only thing that I think I'm good at. I'm not a good manager. I'm an owner in the practice, but I'm not like a CEO type.
Sure.
I treat full time. That's what I enjoy doing, and that's I think that's where my strength is.
Cool.
So I kind of changed my focus, but I always think about what avenue, and it might just be something that we can incorporate under our roof, like dry needling. One of the things I talked about before. So a different intervention that maybe we can offer.
Cool.
I think at some point when I'm ready to kind of slow down a little bit, which isn't, I got kids to put through college, so it's going to be a little while. Maybe doing something where I get to do a lot of one-on-one work.
I see.
To catch on at like a functional training center when I don't have my practice anymore, because the time will come when I kind of feel like my profession is a younger person's profession.
Okay.
It takes a lot of energy, and I've enjoyed it, and I still enjoy it.
Yeah.
But time may come at some point in the future where I say, let some other young guy have a crack at this, and maybe I'd be in a position to do something where I could be, one-on-one at a place that does a lot of functional strength training, and maybe I could lend with some manual therapy expertise.
Cool.
A way that I could collaborate with them.
Right.
And take somebody who's already working at a high level, functioning at a high level, but they've got some aches or pains, and maybe I can take my functional exercise background with my manual therapy background,
right,
and kind of create a little hybrid model.
That would be cool.
Yeah, and even just do it on a part-time basis. I would enjoy that, and not have the pressures of dealing with the insurance world and needing to see a certain number of people.
That's awesome.
Yeah,
that would be cool.
That's kind of a long-term thought.
Have you ever thought about writing an article or anything for periodicals or anything like that?
I've done a little bit of that.
Oh, cool.
Yeah, for me, it's always a function of time. Because as you know, you put a lot of thought and research time into that, and then writing it. So right now, I'm not looking to do it. I've done it in the past. In the future, sure, if I've accumulated some knowledge that I think other people would like to hear about and would benefit from, I would definitely be open to that.
Cool. Trying to think what else. I want to make sure, because I know you're on limited time, so I got to make sure I get this. This is possibly the most important thing. So we've talked about what you do. So really quick, the name of the place is
Score.
And you provide
physical therapy services.
How does someone get in touch with you?
Yeah, call in we have 3 locations, so our main office is in Middlebury, so phone call is probably the easiest way. 203-577-2002 is the main number, but we do have offices in Southbury and Woodbury, Connecticut, as well as Middlebury, where the office you've been to our main location.
I remember when you guys were on Watertown Avenue for a minute too.
Yep.
Wow.
We spent 5 years there. We left there 16 years ago. I can't believe it's been that long. Yeah.
Wow.
Yeah, I know.
See, you've been reminding me of how old I'm getting all day.
Oh, sorry. That's what happens when you catch up with old friends. We got some reminders too.
Yeah. Wow. I had no idea it was that long ago. Jeez.
Yeah, we've been in Middlebury for 16 years.
So, do you think... How much longer do you think you'll be doing it? In other words, being active in it.
Yeah, I mean, to me, if I'm involved in the practice, I want to be active.
Okay.
I want to feel like I'm carrying my weight. I don't want to be... If I'm physically able to, I want to be hands-on and feel like I'm pulling my weight and helping out sufficiently. So...
Awesome.
I mean... Hard for me to imagine a scenario where I'm not doing it for 10 more years at Score.
Good for you.
But the one thing that would change that is if we ever decide to relocate. My oldest son, we were talking before, he's going off to college in the fall.
Yeah.
My twins, my younger son and daughter are 2 years behind them. So,
Right.
if their world takes them to a different part of the country and they, decide to have a family, and maybe Diana and I would want to be closer to that. I don't know what life is going to throw at us, but
Right.
all as it is now, it's hard for me to imagine I wouldn't be doing this for 10 more years.
Awesome.
Yeah.
What does Michael want to do?
Wants to be president of the United States.
Are you serious?
He loves politics, so
Good for him.
yeah. So actually, tomorrow night after work, Diana and I are driving him down to D.C.
Wow.
Yeah, he's got tours at Catholic University and American University in D.C. on Thursday.
Wow.
I've taken him down there twice already. This will be Diana's first trip. So
Wow.
yeah, it's funny. He thought he wanted to go to college in Connecticut.
Mm-hmm.
He's class president. He's always been involved in student government.
Wow.
It's no secret at his school that he really loves politics. So one of his teachers who went to American said, you should look at a school in D.C. And
Wow.
talking specifically about American where he went. So that kind of piqued his interest, and so we've been down there twice. This will be the third time, and it's going to be decision time because it's got to decide by May 1st.
When I was in high school and in college, I did student government, and it was interesting, and it was fun. But I didn't, I did it because it's like, you're a member of a club, and like, we need someone to represent us on the student council.
Yeah.
I'll do it, I guess,
Yeah.
But to sit there and that's a good for him. That's awesome to sit there and be like, you know what, I want to do this. Like, that's pretty lofty.
He's always loved it, and I say president, half kidding, but he wants to be involved in the political world.
Wow.
I think if he could craft his dream job from what we've talked about, he'd be on TV discussing politics.
Wow.
Like any of the cable news opinion shows, whether
Sure.
it's Sean Hannity on the right or Rachel Maddow on the left, to be in there in that world on TV talking about it. So he's thinking about a dual major in political science and communications.
That's great.
Yeah.
That's great.
Yeah.
Wow. So what happens then? Can you tell the president or to go to his room or to knock it off? Can you do?
I'll always tell him to knock it off. He might tell me to go fly a kite, which probably isn't much different than right now.
Right. Yeah.
He would just have Secret Service protection.
Right. They're like,
yeah.
You're like, all right. I am his dad, though.
Yeah.
They don't care. Wow.
No, I don't think so.
Oh my God.
So it's pretty cool because my brother-in-law is a Homeland Security investigator. He's a federal agent. So the last trip we went to D.C., he took us down, got us a White House tour, which Michael was he was floored by. He loved it.
Awesome.
So he's able to get some perspectives into the government through that. So
cool.
Yeah.
Cool.
Good stuff.
Well, make sure you please tell everyone I said hello.
Definitely.
And
do the same, please.
I will, and tell Michael. Just keep charging ahead. That's awesome. When I was his age, I had no idea what I'm like. Huh? What do you mean? I gotta know what I'm trying to do. I don't know now.
I told you I was gonna pitch for the Yankees. That's about how much focus I had.
Right. All right. Well, I know you've got an appointment, Mike. This was awesome.
Yeah, it was really great to catch up with you.
Thank you, and would you be into coming back?
Yeah, man, definitely. It's
awesome.
A good time.
Awesome.
Yeah, thank you for having me.
And because I want to talk to you about sports injuries and what you think. The idea I have is I pick the injury,
mm-hmm.
and we talk about what you would have a certain person do to.
Oh yeah,
I think that'd be kind of cool.
Definitely.
I think people would be interested in hearing that kind of stuff.
Awesome.
All right.
Yeah, sounds good.
Thank you so much.
Thank you for having me, and it's great to catch up.
Likewise.
All right, thanks.